as another viewpoint.
Sure.
Yeah. So
Sure. Awesome.
that's the background on that. So we were going to start with
Yeah.
who you are.
So introduce yourself first, and then we'll go from there.
Sure. Well, my name is Lisa Varnes Epstien, and I wear a lot of different hats. I am a midwife, and I got to meet Lori Beth in the capacity of a midwife and as a midwife educator, for her. But for me, I'm trained professionally as a physician assistant in family medicine and urgent care and emergency medicine, and then also with also as a midwife, which I wove in later in my training. And I had the great honor and pleasure of being able to work in a small rural Wisconsin clinic that had plain folks come and birth in the clinic, in a family medicine clinic. So we weren't a birth center, which meant that we had a lot of latitude to decide what we could attend, or what presentations we were feeling that we could attend competently that might actually have been risked out of other venues. And as our skill level grew, so did the how broad our definition of normal was, and how we could attend a lot of different women with a lot of different pregnancy presentations in this clinic particular. And that's how Lori Beth and I intersected, was her being able to come and work with us. So that plays figures in very, very strongly to even just me and Lori Beth's relationship, because that's how it all started.
So what was your first impression the first day Lori landed in your lap?
So Lori Beth, I think our first conversation was actually over the phone. And then we met in person. I think she came up to come look at the place or something like that. It's been a while now. But what has always stood out to me about Lori Beth, and every single person that you interview is going to say the same thing, is that we all just kind of fell into her laughter. And that laughter and that giggle and that pure joy. And granted, sometimes it was an anxious laughter too, but like we all do that, right? But there's a difference between that and this real presence that came through, and how she presented herself to the world through that her smile, and through that laughter, and through that giggling. That was so incredibly contagious. And I think that made her stand apart so quickly from other people, because not everybody presents that way, and it's very unique to her. And I keep wanting to say, like, we're all unique, but that was different. That was not just same but different. That was like quintessential Lori Beth and how she walked in the world. So I thought that was my first impression of her.
Oh, that's cool. She tells me that the first day she got to the clinic, you were there with a laboring mom and just kind of put her to work, so to speak.
Yeah.
I don't know the parameters of what those words mean. So maybe you could expand on that when you're taking on a new student.
I feel that my role as a preceptor is to allow the learner as many experiences as possible with the hands-on aspect of midwifery, or just care of people. What does that look like? They've read the books and they've taken the tests, but getting your hands on and feeling and sensing and using all of those senses to become, this whole provider is really important. And I know that there are preceptors out there who do not, just have students stand in a corner. And I've never been like that either, whether I'm precepting PA students or, fourth year medical students. It just doesn't matter. If people aren't doing, they're not learning. And so when we say put her to work, it's like, you're working, like you're caring for this person, and I will support you in your efforts to do that. So, kind of gently moving somebody towards their own power and their own understanding of how to kind of be even sort of a couple with the laboring mom or in a prenatal, it doesn't really matter. my role was to let them go as far as they were willing to go, and then fill in the gaps as I saw necessary to make sure that care was complete in Lisa world, how I viewed that to be. And then, so as far as somebody who's willing to go and be involved and do hands-on and care for somebody, I was more than willing to support them in those efforts and help guide those hands.
Did you notice her willingness was quite exciting?
Yeah. Yes, I mean, because it became clear to me actually fairly quickly. I think I didn't know, because she came in with such a unique background too, that I'm not sure that I understood the depth of her knowledge base and already the wisdom that she brought to the table, for caring for folks.
Mm-hmm.
But that did become evident, as our relationship evolved. And so, yes, she was jumping in with both feet. I mean, as much as I was willing to stand back, she was willing to stand forward.
Wow.
And I did find that remarkable. And then as we got to know each other, and she then explained more about her background and her working with you and how much she spent around birth, and she had already, kind of broadened her idea of normal. And that's one of the first things we have to do as midwives or community birth workers, is really working on taking that narrow view of normal that you might see in allopathic medicine, and then moving those borders, those parameters a bit. And she had already done that, so that was easy enough. Then it was just a matter of letting her expand on that, because we had so many women that I think we added it up once, and it was something like probably 30% of the folks birthing at the clinic would have been ruled out of home birth.
Oh.
Yeah, they would have been risked out and sent to a hospital birth. So because we had tools that you don't necessarily have in a home birth, so we had, medications and instruments that we could use if needed, our numbers were actually quite good. But we could present midwives then with situations that they would never see anywhere else. And as we all know, if you can teach somebody theoretically anything, but until they have that baby that's not breathing in front of them, it doesn't really lock in. And Lori Beth was ready to lock in just about anything. She was like, just bring it on. She never looked tired, to be honest. And she looked tired, it never translated in not being willing or wanting to do something, because I also really emphasized self-care. And I think she did. And I hope she told other people that too, that I don't believe in the burned out midwife. I don't believe in the person, the humble brag of, I've just done 5 births in 18 hours and look at me. And I'm like, that's actually a failure of your business for you to be at 5 births in 18 hours. I mean, that's just Lisa's perspective. And so I tried really hard. And I think Lori Beth was really good about that too, about saying, okay, like, we're going to push it a bit here, but we're also going to rest, and we're going to take care of each other. And we're going to make sure that we have a chance to regroup until, we need to do all this again. So she was very receptive to that, and more than willing, to really incorporate that. So I don't know that I ever actually, you would know much better, but I never really perceived Lori Beth at any time I knew her to be a burned out midwife. I just don't. I mean, there's fatigue, and then there's burnout.
Yeah, right.
So.
She got life force energy from doing births.
Yeah, it built her up.
Yes.
And it filled her, and it made her glow. But if you don't mind me saying, but there's a distinction between that life force that you're mentioning, and people who feed on it.
Mm-hmm.
So they're the midwives who feed on their role, and they feed frankly, they feed on their clients.
Right.
They don't know they're doing it. They don't know why they're doing it. But then there are people like Lori Beth, where that life force comes and fills them and allows them to be more than the mortal person they are, because that energy is also filling the room and bathing the room, and it doesn't detract from her. Like it doesn't, that's why she doesn't burn out, is because that life force is coming in and going out.
Yeah.
And she's the vehicle for something that was much bigger than her. And she knew that.
Yes, very much
That's
so.
That's a wonderful way to describe what you had said earlier, Lisa, about Lori Beth herself being joy.
Mhm.
So I would call that spirit or
Yes.
consciousness that she had. And the distinction you've just made is so clear between I would call it egoic midwife or person who does the 5 births in 18 hours, it's like
Right.
Superwoman, or Superman, perhaps, I don't know. And Lori Beth, the way you're describing her is that it came from the inside. I call it a calling. It came from inside of her. And when
Yes.
it comes from inside of you, anything, whatever it is that your passion and love is, your service, then it comes back, it recycles in you. And you don't take energy from other people. You don't
Yes.
have to.
Yes.
It's
don't
like
have
you don't have to do that. It's not an ego thing. It's not a competition thing. It's not,
Right.
there's none of that comes into play. And that's so rare and so beautiful,
Yeah.
because especially in a learned skill.
Mhm.
If it's something that's natural, like cooking or farming or, things like that, or caring for children, then
Right.
it's very fluid because it comes from the inside out. But when there are skills that have to be learned, then there's always that risk that, the ego will get more involved because it has to be, and it has to be learned,
Right.
Yeah.
Right.
So
you have to disseminate information, but then there's what happens next with that information, which can then be, and I'm suspecting that you also understand this, is that there are no firm borders. We're not talking about like, now I'm in my ego and now I'm in my not ego and now I'm in my consciousness. That all of these things are woven inextricably, into the people and what we are as, human beings in spiritual bodies, or spiritual bodies in human bodies. And that when you realize that, I think that then that's the spirit that you're talking about. Like Lori Beth knew that. And it's not that, like, that doesn't mean there's not demons in all of us, or things that want to manifest that make us work hard in other kinds of ways. But she had that core of weaving all of that together, was very much, how she walked in the world, and it was beautiful and it was evident. And there's some people like you probably know that too, is that when the folks like that walk like that, there are people out there that don't, they feel threatened by it, or they're afraid of it, or they put it in their people that make me feel less than, because they'll just have this little box of, people that, or things or events that make them feel less than, and attribute it to other people. But Lori Beth was not like that. She really did weave all of those pieces of her together into something that she was, and not that she's indefatigable, because our mortal bodies are, like, we do get tired, but she knew where spirit came from, and she knew it was coming through her, and she knew she had something to bring to the world. And like I said, that was just evident as soon as she was walking to the room, as soon as she was there.
That's really cool. Can you, when she first started doing, obviously the Amish is a closed community, or, sacred community, whichever you want to say it. And then she eventually started doing births with you at the homes of the Amish.
Mm-hmm.
And then, so was it just the two of you, or was there another midwife that would go? How did that, what did that look like? How did it play out?
The way I worked it with the intern program at Lafarge, those midwives who would come up to work with me, I also had my small home birth practice on the side, which was apart from the clinic. And it's where I actually had a lot more autonomy, because even though we didn't have a lot of, we simply weren't regulated except by ourselves, but we also weren't prepared, I think, staff-wise, for longer births. So we might be a little bit more inclined to use medication to help a birth that was a birthing woman who was just, struggling to kind of get into a regular pattern. And a lot of those women, what we would have done in home birth is we would just leave and say, like, here's some things you can do to support yourself. Let's let it get coordinated and we'll come back. So I really longed for that. And so when I would have a student like Lori Beth, then I would bring them to those home births. And actually I would pay them then on the side, because I also don't believe of getting something for nothing. And so then that would be kind of a separate set of income for them if I could bring them to the birth as a advanced student. So then it would just be me, an advanced student.
Okay.
And this would usually would be somebody that I knew that they would know how to resuscitate a baby. I knew that they would know how to manage, you know, some of the big things that can happen and occasionally happen. And so what they might call, or they call them like low incidence, high consequence events of labor and birth. So yeah, so I brought her to, I couldn't tell you, I didn't have a big, you know, I couldn't really do both the Lafarge practice and have a thriving home practice.
Right.
So I want to say it may not have been more than 4 or 5, you know, that we were at. I'm trying to think who those even might be. And she was great. And then, so in that capacity, it was just us doing our dance together, because it was really fast. And I would say that for so many of the students, but with Lori Beth, getting our dance down was really, really very, very quick, because I just needed to know what she was ready to do, like I said, so I could support her. And as soon as I had more of a sense of that, and we would talk about like, what do you want to do next? Or is there something here that you want to do more of? And then I also stressed people out a little bit, because if we got into kind of a wonky situation, I didn't believe in saving the student. I mean, I'm not going to let anything bad happen to a mother or a baby, but I will push it as far as my clinical skill level will allow, so that they get that experience of doing, because that's so important. And I probably stressed her out a few times, you know, and maybe took her to places she didn't really want to go, but she went there and she still liked me in the end. So I figured it was okay.
You know, it's so many mirror moments about the way I taught her, and in how you taught, and then her duplicating those scenarios with the midwives that she was teaching.
Yes.
Very much a pattern. And
did you notice as kind of a co-birth worker with her, the difference in her acumen and comfort with wonky situations was different after Lafarge?
Totally. But you know, when we didn't have any experiences, we didn't have that opportunity here. Right. And so, but that makes such a difference for so many babies that we did. So many babies.
Yeah.
And they all turned out right. But that alarm and that comfort level had to be stretched.
Right. And getting away from yourself and not bringing your anxiety into the situation. And I think that's where she would shine then, because I saw her move that needle from being anxious about certain situations to going, I know how to address this. And that doesn't mean we don't worry, and it doesn't mean, you know, we don't feel things. We do, but we can address them, you know, without getting in our own way.
Yeah. So there were a couple of moments, but there was a resonance that happened during her experience, and the couples tapped into that and had courage because of it.
Yeah.
Huge.
Yeah. Well, that's a great point. This idea that when she would bring that ever loving light into a room, I mean, we know that it was not only coming from her and settling her and centering her, but it affects everybody else in the room, including this beautiful unborn baby that's trying to move into the world is also responding to that as well. And so when she could beam that out, and then inspire confidence, and not inspire confidence like everything's always going to be fine, because it's not.
No,
things are not always going to be fine, you know, but we're going to do it together, and we're going to have this light around us, and we're going to walk through this journey, you know, as a team, as it were. And she could do that, you know, and she could show her students that too. I never got to see her work with her own students. You know, I guess you never see that
Right.
with somebody that you worked with. And also we're always learning. I mean, I'm sure she learned from her students. I'm sure I learned from Lori Beth. I mean, she was my preceptor in many ways as much as I was hers.
Right.
You know?
I think that's a real truth to it, especially when you're so in harmony, with that fluidness.
Yes.
You can
Yes.
feel that light between you, one heart to another heart.
Yeah.
And
Yeah,
then,
it's very grounding, it's very connecting. And it just makes it easier. But certainly for me, it makes it easier to work with somebody. But then so many, many birth workers, it's fun watching them find that light too. Like Lori Beth came in with it, or it just got stronger,
Right.
but watching them sort of rise and find that light within themselves. And then there's this really beautiful shift that takes place. And the real thing is, and I think Lori Beth could do this, and I saw her do this, can that light and that joy that she could emanate and find while she was at a birth, could she also find that in all the other areas of her life? And could she be that light through all these other situations? Because birth situations have their own complexity, but darn, life relationships are complex too. And I think my experience of her is that over the time that I knew her, is that it did, and probably always was. I mean, I didn't know her before, but always was sort of bleeding into the rest of her life, that sense of joy and light and accomplishment and love and being able to just be able to be present.
yeah.
And the laughter and that beautiful smile.
Yeah, that's why I put out there that I want anybody who had any recordings of her laughing.
Yeah.
That's for sure. So on the experiences like with breech births, shoulder dystocias, things like that, were you guiding from just over the shoulder? How were you helping guide those birth experiences?
Yeah. So it was more of an over the shoulder. I think we had a couple of forehand catches,
Okay.
where it was my hands on her hands and just kind of helping her a little bit with how much pressure, I thought would be appropriate and okay.
Right.
And then this is a side comment. I really wish I had seen the Breach Without Borders or been a part of that workshop before some of the breaches, that I had attended. And there were a couple of techniques that would have come in handy. But for the most part, we did fine, and she did fine, and babies came out, uncompromised and not violently, what I would add.
Right.
So yeah, so I think it was over the shoulder. I mean, I'm a hands off. I'm like, if you're not doing, seeing, smelling, hearing, if you're not processing all of that, then it will be harder for you to learn over time. So for me, it's better for me to back off. I already know how to do it, or I know how I would do it. And then, just kind of allow that space for learning. And so she did, she did a lot.
That sensory memory.
Yeah.
Because you embody it when you're touching.
Yeah.
You close your eyes. So with that one birth I did with Becky, Esther, I don't know her last name. I told Lori I was too busy, but she delivered, she was a shoulder the year before. And then Becky and I ended up walking in. I was doing a training and Becky was doing massage therapy. And this one turned out to be a shoulder too. And so there was a sense of peace. It was like Dr. White was over my shoulder.
Yeah. Yes.
And knowing that it was totally different. Energetically, it was different.
Right.
That was really special. And it was grace.
Right.
100% grace. No,
I think when time suspends like that too, I think that, it's probably happening all the time, but it's really evident that there's a whole story unfolding that has nothing to do with you personally, that it's this whole story that's unfolding that you're a part of, and you
Right.
have this part to play, and you're going to play it. But when that time suspends, I think it's because it allows everybody that is being guided
Yes.
from unknown forces or unnamed, or name them as you will, that there's kind of a guiding that's happening, and then we just submit to that and say, okay, like
Yeah.
I'm just like, and then you, it's another way of getting away from yourself and
Yeah.
doing the work, you
Yeah.
know.
So there was a fun story that one of the midwives from Indiana shared, that she went to a birth and the mom had been stuck at 7 for quite a while. And Lori told her, okay, it's time to go take a buggy ride. And so they took a buggy ride around the field, and then they came in and she was complete.
Yeah.
And you wouldn't think of that,
Yeah.
but that's one of Angel's favorite memories.
Right. It's a very common technique that the Amish will even use to get the labor started. So they'll be like, if there's prodromal labor, they'll just go get in their buckboard, and go on the bumpiest roads and see if they can get a little bit of jostling going, I guess. I don't know. but yeah. Yeah. And I think I've really come to appreciate too. And I think Lori Beth was, being at 7 centimeters for, like not having a lot of progression. Like there's so much going on with any kind of like a dilation, arrest, or regression. That is really, again, it's sometimes beyond, it's more the emotional world or the spiritual world or something else is going on there.
Yeah.
So yeah.
What are some of your favorite memories?
Oh,
close to your heart.
Oh, my favorite memories. I love just, when I would come over and she would get me to go out to the restaurant with her. That was some of my favorite memories, because she would just giggle the whole time, and we would just be giggling about this and giggling about that, and relating stories. And I think also my tactile is and I miss this so much with her, are the hugs.
Yeah.
The full body contact hugs with Lori Beth. I miss those. And those are so memorable. And they're just people who hug like that, which is cool.
Yeah.
I miss, I really enjoyed just debriefing. We would finish up with the birth and we'd go to the little kitchen in the clinic, and again, this is a very small clinic. This is a 4 exam room clinic, right? A little ER, a little waiting room. This is very small, probably, maybe 2,000 square foot building. And we would just sit there and just having those quiet moments at 2 a.m. and still be awake, because some of the birth energy was still kind of, keeping us awake, and being willing to just sit down and talk a little bit about, what unfolded and what that might have brought up in ourselves. And, they're kind of therapy sessions in one way, but they're also just very processing sessions are so important, so that you can take whatever is there and make sure that you're working with it. You're not just hiding it inside yourself or burying it or compartmentalizing, especially if something untoward happened. But even I was very clear, and we both love this. We debrief every birth. It doesn't matter. It doesn't matter. There's so much we don't know was even happening there that needed debriefing. So we debriefed every birth. It would be a rare occasion that we didn't sit at that kitchen table and just take a few moments and just run play by play and kind of figure out, how we were responding to that birth.
We did the same thing when she here at home. Did the same thing, and that was one of my biggest.
Yeah. No. Well, then we both got to have that experience with her too, and she was so willing to do that, which I think that's healthy. I think that's super, super healthy. And so there's that. There was being over at the apartment and just sitting and having tea and watching her move into that space and make that space her own.
Yes.
Was pretty cool. And it was a big move for her in so many different kinds of ways. And I had an inkling of it, but I didn't really know how much, but more just that it was big and it was important, and it was happening. you know,
And she could own it.
and she could own it. Yeah.
The whole
Yeah.
lot couldn't caboodle, the whole thing.
Yeah. The whole thing.
And that was really exciting for me as a mom. And then knowing that once I met, got to know you, I was like, oh, you know how you can just know
Yeah.
there's a mom there you got your skill sets, but there's a mom there.
Yeah. Yeah. Keeping an eye on.
Yeah.
Keep an eye on her. Yeah, and my kind of general MO is sort of, I do have, she knows I don't know that I knew this, but it was more like, I mean, I have a fairly high bar of expectation, but I also, for performance and recall and kind of understanding how things work, but I also gave a lot of space for that.
Yeah.
It wasn't just like, I expect you to know this. It's like, I'm going to give you the space to know this so that over time, that bar, we're going to keep that bar up here and you're going to keep reaching for that. And hopefully we both have, a compatible idea of what that bar is and should be, in terms of care. And so I was a very hands-on midwife. I mean, I know midwives sometimes just like, come in for the grand finale or something. Like,
Right.
We were there. We were with woman. We were there from the moment that person came in, and we were quite, unless we felt intuitively like we needed to not be in the room.
Right.
We were in the room. We were there. We were watching, how a labor unfolds over the space of time, and that learning is phenomenal as well. And so for her and I to share that, and also, I mean, she would be like, I know I probably traumatized her in some ways too, with my what I considered my high bar. I think she alluded to it once or twice. Or just, if that helped her, like, stay on the straight and narrow with her clients and say, like, this is what we're aiming for here. We're going to try and get there. How are we going to do that? How are we going to help somebody get themselves there? We're not, we don't have babies. We don't have babies for other people. We are the guardians and the guides. And so, yeah, so that was a cool memory, having her down at the farm. I don't think she came down to the farm all that often. Right. But she did have a car, and I think she stayed up in Lafarge a little bit more, but she did come down to the farm and just hang out, down there. It was a pretty busy place. She's probably like,
You had a few animals
animals and super busy kids, and it was a crazy, I mean, she knows what a crazy household looks like, but
yeah.
And then my other memory, oh my gosh, going down to the Indiana Midwives Association conference and rooming with her. We roomed a couple of different times, but that first time, I think it was me, her, and Dion. We were all trying to save money, just shoved ourselves into this little room where the third person had to crawl over 2 other beds to get to their bed. And that was a total love-in. That was so much fun, and just being out, nobody's on call, and everybody can just let their hair down. It was a beautiful setting. It was at what was that? I always forget the name of that. The state park down there. Anyway, it was beautiful, and so that was pretty cool. So having those times as well.
Yeah, it makes a difference. You're still teaching, and primarily, what are you teaching now?
So I'm not an active midwife, meaning I'm not catching babies at this time. But I do, one of the skill sets that I have that I can put on the table for the community, and it's very difficult to become certified as a neonatal resuscitation instructor because of all the barriers they've put into place. So there's a few of us out there who have modified the neonatal resuscitation course that every birth worker, every midwife anyway, has to take to remain, if they're certified or licensed. And they have to take it every 2 years. So I took that course and transmogrified it. I just turned it into a community birth appropriate course, as did many other people. And so now I can teach that course. I can't do it as often as I would like, but I try to meet the needs of the community here in the Midwest. Right. And then I also teach the Puerto Rican midwives. So I go to Puerto Rico, and then I go to Hawaii. So I work a lot with particularly with Indigenous midwives and Indigenous traditional midwives who everybody pretty much believes and embraces. That's the one thing I think we can all come together on, is that having resuscitation skills for babies is like irrefutable. I mean, this is a skill we all need to have. We need to know what to do next. And there's a lot you can intuit into that, and a lot you can be led by spirit in the course of a resuscitation. But there's also some very basic sequences that are amazingly effective, you know, for most babes. Yeah. So I do that. And then, and because with my PA training, I went to a surgical PA program. And so I teach suturing for birth workers, so specific perineal suturing, postpartum. And that's always fun, because hard skills where people are having to put sharp objects in other human beings, which is not normal. Is like nobody comes out of the hatch saying, yeah, I want to like stick a person. And if they do that, we need to like maybe work with that person differently. But you know, that's tough, demystifying those skills and, you know, giving people those skills and helping folks see, you know, your resuscitation skills are your tools, are your brain, you know, yeah. First and foremost, and very few things that you can fit in your back pocket. Yeah, there's very little you need to be very effective to do effective NRP. And then and then for suturing, it's very similar. I mean, you just need to know. So I'm very concept based. I don't believe midwives should be rote trained at all. I don't think they should be protocol trained in the sense that they walk down a protocol and that's how they practice their skill. I don't see that at all. So I think what I try to do is really bring the art in, and the concepts, the physiologic concepts in, so that when push comes to shove and things aren't going down a certain pathway, you already know what kind of is supposed to happen and why it's supposed to happen. So if you need to open a back door to affect that, whatever change it is you're trying to affect, then for sure, you know, you can do that. So those are the skills that I work really, really hard to give people. And I think Lori Beth, you know, really picked up on that as well. There's some really cool people walking into my life right now.
Is that Christelle?
That's Christelle. Hi, sweetheart.
The baby.
Can't wait to hug you and the baby. Anyway, yeah.
I just want to say thank you so much for, you know, being in this segment unexpectedly.
Yeah.
So, well, I want to get you into a room where I can just hug you.
I do want to say that Lori Beth travels with me at all times. She informs the workshops that I teach, certainly like my corporal life. Her worsted wool heart is on the altar at every workshop. The roll that she made for me for the shoulder roll, which I can't give up. It's probably got so much microorganisms on it that but I decided it's enhancing everybody's microbiome, but it's like, it's going to disintegrate at some point, but I still use it. And then also, you know, so those are like the physical things that help remind me of her and bring her into my life, you know, mindfully. And then there's just the way that I see her in a laugh. To be honest, I will never hear another laugh like Lori Beth's. No. I just won't. And I know that, but I will look for it my whole life, and I will find it perhaps in my dreams. And she will always be walking with me as I actually start to not really even call myself like these names, like I'm a midwife or a PA. I exist in the art of the healing world, and that's where I live, and that's where she is with me. And I love that about her, and it has singularly been one of the greatest gifts of my life, was to have her with me and to teach me what I needed to know.
I love you.
So let me ask a question of both of you. You talked a lot about centering around Lori Beth and her story. What's the story between you two women?
We co-mothered Lori Beth.
Yeah. Exactly.
I could do what Carol could not at times because of the nature of the game between mother and daughter. So I could be her voice in a way that Lori Beth could hear me, but might not hear her mother.
Right.
And probably vice versa. But I think in that way, and there are a lot of people, I think, in Carol's life that that function in that capacity. And I was just one of that web. And so, you know, I could do the finger wagging in a way. I could, you know, I could do the verbal, like just friendly, slapping her around, like, come on, like, you know, what's happening here, you know? And she could hear that from me, which was great, which was beautiful. And I used it. Absolutely. I used it to my advantage. And to Carol's advantage and to Lori Beth's advantage, because I felt, again, if we're being moved by spirit, then I was moved to say certain things and act in certain ways to shake it up a little bit, you know, from time to time. And I have no compunction about doing that, because if I'm being told to say that, I'm going to say it.
And you can be Switzerland when you need it to be.
And sometimes I need to be Switzerland, or you saw me in Switzerland mode.
Yeah. And vice versa, when she felt the pressure a little bit too much, and, you know.
Yeah, that's for sure. That's for sure. I'm sure yeah.
At first she was like, it seems so big, right? Mm-hmm. But the methodology and the style you used, she already grown up with.
Right.
So it didn't change. It wasn't something, it just was the next layer. Layer. But the methodology was there already. So that was beautiful, because I didn't expect that. But then once she said she was accepted, we were both so excited.
Wow. Well, it was, you know, I think it's that language of life. Like you hear the language of, it's the same concept, or, you know, the same thing that you're trying to convey, but you hear these different ways of people saying things, or acting that out, or watching that play out. And I think the more, it's almost like those love languages, right? But the more it's kind of like, well, how do you do this one thing? How do you get, like, that mansion of doors? Like, which door are you using? What does that look like? Right. And what kind of toolbox are you putting together? And I think that definitely, and then that's in all things, not just the hard skills, but the soft skills and the arts. Right. Yeah, and I think, you know, honestly, I mean, Lori Beth does go on. Her healing does go on. Her presence does go on, and it forms a lot for a lot of people. Yeah. So I miss her, or I miss the physical part of her, but spirit Lori Beth is here, present, and accounted for.
Very much so. Very much.
Carol, I have a question for you.
Yeah.
That Lisa may or may not know. This is a good part too, right?
Yeah.
When you remember Lori Beth and you remember her speaking about Lisa and about their experiences together, what comes to your mind in terms of Lori Beth as a student, you know, and in terms of her relationship with Lisa, and what impression Lisa made on her?
There were a couple of things. She loved her. She didn't want to disappoint her. She was encouraged because she let her put herself all the way out on the limb, and she knew she had a safety net. So that gave her more boldness. And it shows up, and it kept showing up, the boldness and the like quantifiable results. She'd already done it here, so she could do it here. It built her continual confidence level. And but bar none, number one. Okay, perfect. She loved you.
Oh, thank you. Yep, we have a very special relationship even now.
Yeah.
You know, and I don't think there's any better thing I can imagine, and I have a big imagination of having that kind of love present when the soul takes the body.
Yeah.
You know, that conduit, the whole honored tradition of midwifery, and the reality that it is a feminine role in life, to carry life and to bring it forward, to be that conduit between the soul and, in its independent state. And I just want to say thank you to you, Lisa, for the work you've done and are doing. And Carol knows how I feel about her and what she's doing. And the impression that we give each other, and it's very visceral. It's tangible.
Yeah.
The light and the love that comes through when someone's born, and how it impresses them from that moment forward. And so the joy that you were talking about with Lori Beth, that's because of her birth and her mother, and and what happened there. And do you want to record some of that on this one, Carol? About
just a short one, and then I know we have to go. So Lisa, what I didn't tell you, when Lori was being born, we find out she's breached. The doctor's okay with that. And the very brogue Irish nurse said, "Why are you smiling?" And I've been pushing, and she goes, "What?" I said, "I didn't know I wasn't supposed to be."
That's great. That's great.
So, and that's the truth of it. I was just like, it's still stuck to my mind, because I was grateful that my mom was in the building, because she couldn't be with me. That made a huge difference for me, knowing she was at least in the building. And I think when you were here with us, you were in the building.
Oh. Wow.
And it was the most beautiful experience. I think, man, we blew it up as big as we could for as long as we could. And people still today tell me what a difference that made in their life, and how they viewed, the passing of one's soul to heaven.
Yeah. And what that can look like, and how that can be a community passing, really. I mean, a community event that we all participated, in our various, everybody had these roles. It was just beautiful how that all fell, together.
For sure. So,
Yeah.
Barbara, thank you for giving us this space.
Very welcome.
To do this.
Yes, thank you. Nice sort of talking to you.
Many blessings for you and your work, for your life.
Thank you.
Carol, I'll see you next week.
Yep. Thank you very much.
You're very welcome. Have a great day.
Okay.
Okay, good people. Goodbye.
Bye.